Hello, today I'm going to demonstrate a physical assessment, abdominal assessment, and a skin assessment. Of course, you would want to verify your order, perform good hand washing before and after patient care, verify the facility's policy and procedure, and get your equipment together. Uh, Consult the manufacturer if needed. Knock on the patient's door, identify the patient using two identifiers. Explain the procedure to the patient and provide for privacy. Assess the patient's overall condition. Raise the bed for good body mechanics. Don PPE if needed. After completion, lower the bed back to the right height, give the patient the call light, report any abnormal findings to your nurse. And first, with my physical assessment, I would want to just ask my patient, what is your name, your date of birth, are you male or female, which is obvious. What's your allergies? Do you take any medications? Do you do any illegal drugs? What is your family history? What kind of diseases does your family have? Health issues? Do you have any health issues? Have you had any surgeries? Have you had any diagnostic tests? Are you married? Do you have any mental illnesses? What immunizations have you had? What is your height? We'll get your height and weight. How old are you? Then of course I would want to get vital signs on my patient, which is temperature, pulse, respirations, and blood pressure. And of course, normal temperature is 98.6, which it can range from 99 or 97 to 99. You can get it on the forehead. Usually it's an electronic one, and you can scan the forehead, or they have you can get it under the tongue or under the arm, in the ear. You would want to get their respirations, which normal is 12 to 20. You would count those for a minute. Just look at the when they breathe in and out. Is it shallow? Is it deep? Are they breathing heavy? You can Brady is slow respirations, Tachy is high respirations, Cheyenne Stokes, which is like the end of life. They could be like hyperventilating, anything like that. You would always want to report your findings, document. Check their pulses, which you have your radial, which is on your wrist, your brachial, which is right here. You have your femoral, which would be right here, your popliteal, behind your knee, your posterior tibula, which is on the side, outer side of your ankle, that pulls right there, and your dorsalis pedis, which is right on top of your foot. You also have one pulse that you can do carotid in your neck. Average pulse rate is, I think, let's see, 60 to 80, something like that. You want to listen for a minute. Are they tachy? Are they tachycardic? Are they bradycardic? Listen for a whole minute. Then next you would document your findings, especially if they're abnormal. Next you would get your blood pressure, which you would put your blood pressure cuff on your patient. Depending on the size, you would always want to make sure you got the right blood pressure cuff for their size and weight. You just put it around their arm. And you can actually put it on their leg too, if needed. And then, of course, you would want to, once you get it on their arm, you would want to pump it up 30 over what you think their systolic blood pressure is. So I usually pump it up to about 180. And then you release your little dial slowly. And that first sound, that first thump that you hear, that would be your systolic. And then that second sound would be your diastolic pressure. Normal blood pressure, 90 to 120, or no, 90 to 140. Systolic, 60 to 90. Diastolic is usually your normal range for your blood pressure. Of course, document your findings. Next, you would want to assess the patient's hair. Just look at the distribution of the hair. You're looking for any parasites. Make sure you don't see any parasites. Just look at the patient's overall condition, the hygiene. Do they look clean? Look at their clothes. Next, we're going to do, you could get a pen light and you could do the, see if your pupils react, which you would kind of want the room to be dim, but you would get your pen light and you would just go from outer to inner, and if your pupils, react, then that's normal. Look at their oral mucosa, check their teeth out, look at their, check the patency of their nose. Then you would want to listen to their lung sounds. You can also listen to their heartbeat at this time. Okay, and then you would want to assess their gait. You would have them walk in a straight line. You would want to assess their strength. You would have them squeeze my hands, try to push down on my hands as I'm pushing up, just to test their strength. You would also want to go ahead and do an abdominal assessment, which you would want to ask about their bowels. Do they take laxatives? What is your normal bowel movements like? How many times a day do you go? Are you regular? Have you had any diagnostic tests? Is there any history of cancer in your family? Of course, you would always want to listen to your bowels before you palpate them. Just kind of overall look at the abdomen. Is it round? Is it rigid looking? When they take a deep breath, does everything look symmetrical? Of course, when you do your abdominal assessment, you would want the patient to lie back so you could get a good assessment. And then you would just listen in all four quadrants, which you would want to start with the right upper quadrant. You would want to listen for a full minute, and you would hear like gurgling, growling noises, so you would know that would be normal. Sometimes they're hyperactive, sometimes they're hypoactive. Then you want to do the left upper quadrant, left lower, right lower. And then you would gently palpate. Is it tender? Is it firm? Is there any pain when I'm palpating? Also, you would want to ask your patient during the physical assessment of, family history and all that,